Hi, I'm Nikki. I'm going to be demonstrating an IM injection today while doing my general principles and safety practices. I'll also be doing my 3 checks and my 11 rights. I'm going to perform hand hygiene. And don clean gloves. And then I would identify the patient using the 2 identifiers. Can I have your name and date of birth?
Jacob Grace, 6/25/53.
I would check that with the armband. Okay, that matches. Then I would go ahead and assess the patient for any allergies. Do you have any allergies?
Possibly bee stings.
Okay. Then I would also do any other necessary assessments before administering the medication. Now for this injection, there's 3 possible sites that we could give it in. The first being the deltoid. Turn to the left. For the deltoid, you want to find the acromion process, which is the bone here at the top of the shoulder. You're going to want to go 2 or 3 fingers down from the acromion process, and then you would draw an upside down triangle from that, and it would go right in the center of that triangle. The next, take a step on the ladder, turn toward the camera. The next would be the vastus lateralis, which you would divide your thigh into 3 sections, both vertically and horizontally. Turn back toward the door. And you want to go in the outer middle third of the thigh. The last, turn completely, would be the ventral gluteal area, and you would do that by placing the palm of your hand on the greater trochanter with your thumb facing the groin, your index finger pointing toward the anterior superior iliac spine, and your middle finger pointing toward the iliac crest, and you would inject between those 2 fingers. You can get down and sit down. For this injection, you're going to want to use between a 20 to 25 gauge needle, 5/8 to 1.5 inch in length. For this one, I'm going to be using a 23 gauge needle, 1 inch in length. I would take an alcohol pad and wipe off my valve and allow that to air dry. And then with my dominant hand holding the syringe, I'm going to remove the cap, and I would take the needle, insert it into the valve, and then I would draw up the medication to the right amount. For this one, I'm going to use 2 milliliters. And then I would slide the needle back into the cap. Then I'm going to take another alcohol pad, and I'm going to clean the site that I'm going to be using. I'm going to use the deltoid. You're going to want to clean it in a circular motion going outward. And then you're going to want to allow that to air dry, not fanning it, not blowing on it. And then with my dominant hand, for this injection, you're going to want to use a 90-degree angle. I'm going to take my dominant hand, push the needle into the site, inject the medicine slowly, immediately remove the needle at the same angle I put it in at the 90 degrees. I would engage my safety device, dispose of my needle in a sharps container. I would place a piece of gauze over the site. I would then remove my gloves, perform hand hygiene. I would document the medication, and then I would go back and evaluate the patient's response to the medication.